So you're medicine resident or?
No, so I'm wanting to sit my memberships.
Yeah, perfect.
Did an internship last year,
Yeah,
back in general practice.
yeah, cool.
Yeah.
So the reason I was asking is just like what questions I can ask you at what level and stuff.
Yeah.
And obviously don't make it applicable to whoever, because lots of people watch after the fact because they don't want me to pick on them during.
Oh.
Um, yeah. So I'm very happy to not ask you questions and just like have a bit of a discussion of what you're seeing in practice and stuff at the moment. And I promise not to put you on the spot if you're uncomfortable with it. But if you want to be tested, if you're thinking about memberships and stuff, I'm also very happy to do it that way.
Yeah. Be honest, I haven't done my deep dive study into GI tract yet.
Yeah.
I did work a little bit with Carolyn Mansfield last year.
Oh, cool. Yeah.
He obviously loves the gut, so
Yes, yeah.
hopefully I absorbed some stuff from her that's
Yeah.
back of my brain somewhere. But
And this is an interesting, like, the way that Edinger's kind of split up is that all the clinical presentations are in the early part of like, we've kind of already gone through like diarrhea, vomiting, and stuff like that. And now we're into the section of the book, which is really specific diseases,
yeah,
which I almost feel like it's working backwards. It's sort of like you lose the clinical relevance a little bit, and you're not just talking about one organism for a long time where its relevance might not actually be that high. So I do want to try and like keep kind of referring back to the clinical relevance. And I think probably the way to do that with enteric pathogens is like we're doing fecal PCRs and fecal testing. What are we looking for? And does our clinical presentation correlate with those?
oh,
Yes. So then we talk about the individual organisms and the way they impact a bowel. And could this be because of that, or is that just an incidental positive?
yeah,
So we'll try and kind of keep that structure if that's all right with you. Awesome. I kind of in my head like divide things up into bacterial, viral, fungal, parasitic, protozoal, just to try and kind of have a bit of a structure to talk about stuff. But is there any kind of things you're seeing more of in particular in Townsville that you want to prioritize talking about?
Obviously we do get the weird and wonderful fungals.
Yeah.
Yeah. Um, but really, I don't know, I'm probably a bit naughty where I don't do a lot of um, the fecal PCRs. I do see a lot of wormy dogs where I'll do a fecal float and there'll be a bunch of strongles or something
Okay.
like that. And then we do probably see a little bit of whipworm because they come in with the hematochezia, and then I do a worm trial and that seems to resolve them a bit. But I actually never find the worms.
How annoying is whipworm?
Yeah.
Yes. I had
So
this dog, I was so sure it was whipworm. Like I could see the worms on ultrasound in its gut. I'm like, it's like there's the worms in this dog, and I just tested negative and negative. So annoying. Anyway, it
yeah.
got better after had a full protein losing enteropathy.
Okay.
Yeah, from the degree of kind of blood loss. Uh, yeah, and eventually it just kind of got better after we wormed it. So who knows?
Yeah.
Yeah, it's an interesting case. But that's interesting because like where I live, like worming compliance is so good, like almost more than I would recommend for like future IBD kind of prevention.
Yeah.
I don't see very many worming dogs at all. Which so
We obviously try with our clients, but we do have some that are, a bit naughty. And I think just up here, it's a prime area for some worms.
yeah,
We get a lot of
drying out there.
we have a lot of puppies with hookworm. Like the other week, it came in for its 6-week vaccination and was white as a ghost. And I was like, have you? So it went to emergency and got a blood transfusion and all the fun things.
Wow.
And it was due for a worming tablet, due for a vaccination.
Yeah. Wow. Yeah, so that's, I guess, a different perspective from what we typically see. And so most of them, like with the different types of worms, you mentioned whipworm, hematochezia, are there different presentations that you see with different types of parasitic infections?
Um, I guess most commonly up here is our just like persistent diarrhea, or yeah, waxing and waning diarrhea.
Yeah,
The odd dog might have the vomiting as well.
yeah,
Um, I think we typically probably see them before the weight loss and stuff kicks in, if I'm honest. I think
yeah, that's good.
something else first.
Yeah,
But um, yeah, I don't know. We've got, and I guess a lot of the time, they're not really wanting to do a lot of diagnostics. So a lot of them we kind of just treat
worm it. Yeah,
and then maybe send them home with some Zofran, and they tend not to come back. So it's like, was it a viral upset or was it actually,
worms. Yeah,
yeah,
yeah, that's a tricky thing, isn't it?
clinical setting? We just kind of, a lot of the time, just treat the signs more than anything. And
Yeah.
yeah.
And do you do a lot of fecal floats?
I'll do fecal floats and fecal smears
Yeah,
just in-house typically.
yeah.
But yeah, I don't know. Carolyn wasn't too keen on fecal PCR, so I think I probably
Thought that.
she was like, of course they've got bacteria, like it's the gut. And I'm like, okay.
Yeah.
So yeah, I probably just haven't utilized it, or tried it on cases in myself to really know if it's worthwhile doing that.
And the PCR doesn't really test for the parasitic diseases. We still need
No,
to, yeah, do the floats and smears to review, like to get the full kind of spectrum of what's going on in there.
yeah,
Even then, it's not the full spectrum, is it? Like, how flawed are all of our tests for diarrheal diseases?
yeah,
Um, so I guess like the fecal float, particularly where I live, because I'm spoilt, Simone, I was just saying that we don't see wormy dogs anymore. Like, oh, there is a bit of a resurgence, but compliance with worming is so good, and therefore worm burden in the environment with the dogs I'm working is so low. Um, so there's no worms basically. So I've kind of lost confidence in my ability to recognize the different types of eggs and stuff. Like
Oh, I would always send it off. Oh, no way am I looking at it in-house. Gross.
what about a fresh one? Like we know that sending it off compromises the like sensitivity of the test.
Even if they look at it the same day?
Yeah, for sure. Fresher the better.
Mm. I don't even know if our clinic has the stuff to do it.
A fecal smear.
Oh, fecal smear. Okay, all right, we can do a smear.
Are you
I've
gonna?
done a smear on. I've done a smear on a couple of cats with
Yeah,
fingernail business. I've done
yeah,
that.
yeah.
the float, you can use the large animal float stuff if you're a
We
mixed.
definitely don't have that.
Oh,
We do not have any floating stuff.
Simone's a medicine resident, so she's with
oh, definitely don't have large animal floats.
small animal medicine. Yeah. Um, so this is why I was asking when we first got on, it was just Katie and I was asking, oh, what's your background? Where do you work? Let's try and make this, yeah, applicable. Because there's such a variety in what we see where we
So should we be doing more smears, do you think, Anna?
I think no. Yes, ideally we should. If we've got a chronic diarrhea dog or cat, I think we should probably be doing a fresh smear, a
Mhm.
fecal float, and I think there's no reason why both of them can't be done in-house if we've got somebody that like feels confident to do that. But because I just never see them, I've lost that confidence. And as a result, I send it out. But particularly with the protozoal diseases, the smears are like the way to detect them, and
Yeah.
that you limit the sensitivity by delaying it by quite a lot.
Mm.
So
Protozoal diseases, what do you think about the PCR? So I have had a few cats where I've been looking for trichomonas where I have sent it off for the PCR.
Oh yeah, I love the PCR for that. I just that all of the tests are flawed, and it's the best of them.
Okay.
So we talked a little bit about parasitic disease. I was just saying, in my mind, I'm going to try and kind of make sure that we cover parasitic, protozoal, viral, fungal, bacterial. And I was like studying infectious diseases. You could talk about individual organisms, but it would take you 20 years to get through it. So do want to keep it with clinical relevance, because I think whatever level you're studying at, if you're thinking about sitting memberships or fellowships, questions have to be kind of clinical most of the time. So they might say, discuss the sensitivity, specificity, and clinical utilization of fecal PCR testing in a chronic diarrhea patient, or something like that. So then I'm going to prioritize talking about the organisms that show up on those panels and what the value of a positive result is, by like specifically talking about how those organisms interact with the bowel and whether that positive is the cause of the diarrhea or not. And I think we all know that there's big limitations there. So if we go kind of say, okay, parasitic disease, and then if we start talking about protozoal disease, I think, so let's talk about what the type of protozoal diseases that we see.
Like as in specific species?
Yeah.
I mean, giardia in dogs.
Yeah.
And trichomonas in cats, I think.
Good. And what's the relevance of giardia when it comes up on your fecal PCR?
Excellent question.
Excellent question.
I think they've shown that lots of dogs without diarrhea have giardia.
Yeah, exactly. Pretty high carrier status.
Yeah.
Um,
And has something else upset the gut, and then you find the giardia.
And it's interesting because we work with so many like clinics, we do sometimes see a cross section, and we hear about all this PCR. We get called in to do an ultrasound in dogs with diarrhea, and we see the PCR results. And it is interesting to see, like, sometimes there's little clusters, there's like bursts of giardia.
Yeah, okay.
In those dogs. So like there is definitely evidence that it can be associated with diarrhea in some patients. But 10 to 30% of dogs are carriers. So the overlap between a dog that's got diarrhea for some other cause and a dog that's got diarrhea because of the giardia is too big to then be able to like get clinical relevance for that. Giardia is a little bit easier to diagnose than trichip. Why?
Tritric is really sometimes not shed very much.
Good, excellent. Yeah. So
Sometimes they recommend doing more than one or something, like,
yes.
which I've never done, but
Yeah, I have. I've looked really, really, really hard. It's very frustrating when it comes out negative.
And you meant to, because sometimes like the diarrhea might be intermittent, you're meant to send the one that is diarrhea.
Yeah.
Right? I think.
Ideally, yeah. There's a few different, I mean, it's so impractical, isn't it? When, particularly in a referral setting where people have traveled to see you and you say, okay, well, the stool sample I've got today is not the one that I want. I want a different one.
The one that looks,
yeah. Yeah. So trichomoniasis lives intracellularly within the colonocytes. And it's actually only shed from the colonocytes, or like, I'm going to say enterocytes because I'm not actually sure. It's not necessarily localized to the colon. It might be in the ileum as well. And then it only sheds once every 3 days on average. So it would be really easy to miss it in a single fecal sample. There's a few different ways around that as far as like the way that you take the sample to do the test. So if we're looking for genetic material, so it doesn't have to be alive. So the freshness of the sample doesn't matter so much in this context. So if we're doing a PCR, which is the most sensitive way to detect it, we could pull 3 days of poo and mix it all up and then send it to the lab as one sample without the, charging for 3 days, and in theory have more sensitivity. And then something that I do, because collecting poo for 3 days is unpleasant and most people don't want to do it. If I've got a patient sedated for an ultrasound, we'll put a red rubber catheter rectally, flush 10 mils of saline in to the rectum, to the colon, and squish it around, like traumatize the colon around the red rubber. Which then you're actually collecting colonocytes.
So
So you're more likely to get a positive with those intracellular organisms, even if it's not shedding at that time.
Yeah, right. Okay.
So 10 mils of saline, slowly, you don't want to like, and then you just suck it back out again. And always your catheter gets plugged with poo, and always you end up with 1 or 2 mils and a colon full of diarrhea because you've just filled it up with water. So it's super messy, not amazing to do, but higher sensitivity than,
Why is this?
yeah. So that was from, I want to say CVT 15,
Okay.
therapy 15, and Jody something is the author of that method, but that's something that we recommend. Like, we're often got the sedated patient, we just say, let's do this right now, like just to, the history is very convincing for try treat. Let's, yeah, see if we can get a diagnosis. So
When you say the history is very convincing, is it more if there's large bowel signs? Is that what you are going for? Yeah.
yeah, chronic hematochezia, patients from boarding or breeding environment,
Multi-cat, yeah.
multi-cat households, exactly.
Yeah.
And that chronicity with diarrhea, with kind of everything else kind of ruled out,
Yeah.
and no diffuse small intestinal changes. Like, it's not like we've got kind of IBD, no vomiting or anything like that, just all smelly, stinky.
Yeah.
Bowel. Yeah. And yeah, the hematochezia and slimy poos are the giveaway.
Yeah.
Just gonna see what my notes said about tri-trick and make sure we talked about everything I wanted to. Oh, with giardia, I'm not sure I know the answer to this, but what is the zoonotic risk with dogs that are carriers or infected with giardia and humans?
I don't actually know what the risk is. I mean, I know it's zoonotic, but I perceive that in a healthy human, the risk is likely to be pretty low. I mean, these people are living with these dogs that are carriers.
Yeah, exactly.
Not getting giardia all the time, but maybe would be more careful if there was, I don't know, immunosuppressed people or something. I don't know.
Yeah. So I know that there's subtypes of giardia, and I should know this a lot better than I do. And the subtypes infect different species preferably, kind of thing.
Okay.
So I think I know that humans get giardia subtype A and B. And I know that dogs can carry or be infected with those, but they're more likely to be, I want to say, infected with E, pathogenic. Yeah. So I think their zoonotic risk is actually very low. And the transmission, do you know what the route of transmission is? Do you know what I mean when I say that?
Fecal oral, is it?
Yeah. Fecal oral.
Yeah, exactly. Yeah. So really just normal hygiene around handling the bum, really, and the poo. And you're much more likely to get giardia from water sources than from your dog as a zoonotic.
Even here in Australia.
Yeah, from water sources, absolutely. Yeah. The area that I live in is on like a peninsula, and the water pipes get like pretty scungy by the end, which is where I live. And we've got a much higher prevalence of giardia in our area because of that. Yeah. Yeah. Yeah, I think that was all I wanted to talk about protozoal wise. Are there any other protozoa we should have on our radar? There are. The answer is yes.
There is.
Yeah. One for
You think
fecal PCR. We'll say again.
coccidia?
Good, excellent. Yeah.
Is up here.
Yeah.
An older dog had been to a kennel. And
Yeah.
I was like, this is weird. I normally see it in our young puppies, but I was
Yeah.
like, obviously, and then I was like, your dog might be immunosuppressed for it to be having coccidia. Your dog unwell in any other way.
Was it all right?
Yeah, the owners were a bit cost constrained, so we just treated the coccidia, and they haven't been. I'm assuming
It went away.
I resolved it.
Well done.
Give myself a tick.
Yeah, that's right. How do you treat it?
Toltrazural is what I use, the
Good.
base.
Baycox, yeah. They can use TMS if they're like really sick with it. But Baycox is typically effective. And there's one more protozoa of can be significant primarily in immunocompromised patients. Again, comes from water sources. Cryptosporidium.
Oh, yeah.
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 Again, there's no real evidence like animals can carry it or they can be infected by it. So its presence in a diarrhea patient is like not diagnostic for the cause of the diarrhea. But it does cause villus atrophy and very watery chronic diarrhea. So the character of your diarrhea, like if you got a positive on crypto and it was very kind of watery, and causes weight and with weight loss and stuff, like often concurrent infections as well. In that case, I'd probably lean towards, oh, maybe it's worth treating for that. And very significant zoonotic risk for immunocompromised humans. So that's a protozoa that is probably worth detecting in as far as managing kind of the family.
So do you think if you find it, it's worth treating them, even if, like, I suppose that's the question I have when it comes to zoonotic risk. Like, if there is significant zoonotic risk, should we be treating them, even if we're not 100% sure that that's the cause of their diarrhea?
Well, I would say no. I would probably talk to the family and work out what the risk is. Like, how do you live with this dog? Okay, when it does have diarrhea, is it consistently making it outside to the grass? You have babies with immunocompromised crawling on the grass, or is the dog pooing in the bed? Does it have big feathers and have poo caught in the like I'd sort of weigh up the risk of contamination with risk of exposure and the risk of the people involved in that situation, and just, I guess, make sure the clients knew that they really needed to be a little bit more careful than with other dogs. But if there's diarrhea, I probably would treat it if I hadn't found any other cause of it.
Yeah.
Like, yeah, just in case.
Do we know, like, can you, if they're a carrier, treatment likely to, I wonder if treatment's likely to eliminate that or not? Does it just come back?
Yeah, I don't think so. And crypto is a infection that treatment is not consistently effective. So really we're aiming to manage the diarrhea, which manages the environmental load, I would say, rather than get a PCR negative. So treatment typically azithromycin or tylosin reduces shedding, but doesn't necessarily clear infection. So it might be more a management with the client. Let's talk about fungal because it's very small. Does anyone think fungal?
Prototheca.
Good. Yes. Tell me more.
Oh, my one Prototheca case, I couldn't find it in the food, but I found it everywhere else in the dog. But that's I think colitis is how it presents in some Prototheca dogs.
Yeah, right. I've never seen it.
Oh, my
Like,
dog, the eye specialist diagnosed it and sent it to me, but I did find it in the urine, so that's cool.
Wow. And how did you, what does it look like? How did you know? What does it do? Where does it come from? Tell me more.
Well, it's an algae. I mean,
Yeah.
well, it's technically not a fungus, I don't think. I think it's technically an algae, but it's under the fungal heading. Water sources is where it comes from. And this dog must have just been incredibly unlucky. It just lives in the city, so I don't know.
That's weird.
Like it has a sibling dog that was perfectly fine. So the dog wasn't immunosuppressed that I could see, like a 5 or 6-year-old oodle. So this dog presented for a primary eye, really severe uveitis, and the ophthalmologist took some eye fluid out and sent it to the pathologist, and they saw Protozoa, which is
Wow.
fairly impressive. But then I sent urine up to Sydney. Actually, Richard Malik, they looked at it for free, or he asked the lab to look at it for free, and they found it in the urine as well. But I also sent off some poo, but they didn't find it in the poo, and the dog never had any diarrhea.
I'm just going to Google what it looks like quickly. Everyone should do the same. Like, how distinctive is this organism? Oh,
I think you'd need to be a good pathologist, but
yes, yeah, for sure. And I guess it doesn't belong in an eyeball, does it? Like, that's a
I
nice,
don't think any organisms belong in an eyeball. Yeah.
it's a nice fluid sample to get without like any other kind of.
Yeah. Like I can't imagine that looking at it in poo, looking for it in poo would be much, much harder.
Yeah, for sure. Good point. Interesting. That's a cool case. The other one, cool, like not true fungus one, is pitheosis. Stagnant water again. Infection with stagnant water. And apparently, Richard Malik mentioned there's been a few cases of this in Sydney.
Yeah.
I hope I'm not getting that confused. There's a chance that that's not true, but I wouldn't have even had it on my differential list, and it's not something that's in the fecal PCR.
Often you get like a mass with pitheosis, right? Like an intestinal,
yeah,
or I don't know, a gastric, I don't know, gastric mass.
Yeah, yeah. Have you seen it, Katie?
Yeah, we had a case last year up in Townsville at the specialist centre. So yeah, I think it was like an X-lap.
Oh right, yeah,
yeah,
yeah.
From memory, it was an X-lap, and there was just like a big mass that had kind of tangled up multiple bunches of intestine to it, sort of thing.
Yeah.
I think when they sent it away, it was a fungal, and I think they decided it was pitheosis. From memory.
Wow, that's so interesting. So I don't think I've ever seen it, but I say that, and I've seen so many cases now that I just have to probably say I've missed it. Like I've probably seen it and I've missed it. But it's on my radar now that we've done this tutorial. So I'll be writing in my differential list Protozoa and pitheosis now for everything. But it's nice that it does cause a mass in that it's kind of a little bit more distinctive in the way that
it's something to look for.
Yeah, exactly. So treatment, surgical resection of that mass, the infection, and antifungals like terbinafine, itraconazole together. Prognosis is poor.
It is for Protozoa too.
Is it?
Yeah, my little doggy died. I kept her alive for like 11 months, I think, which is not too bad.
Right. What do they die of? Just chronic inflammation.
Fungus going everywhere. I think it went into its brain. This little dog, he had seizures in the end. Yeah.
Yeah, right.
Fungal, very good at disseminating.
Yes.
Yeah, and this dog, she was on posaconazole, terbinafine, and I did a whole course of amphotericin B until she went into almost kidney failure. So I tried. Yeah.
We had an Aspergillus dog where we tried amphotericin, and it had a hypertensive episode both times we tried. So
shame. That's tricky. I hope I don't see them now because people will ask me for advice on managing them, and I'll be like,
my advice is just tell them to email Richard Malik. He was very helpful with the Protozoa case.
Can I just say, I think he might be the most influential vet in Australia. Like he is so helpful.
For infectious diseases, 100%.
But like for someone to have that level of expertise, and everybody you speak to is like, oh, Richard Malik helped me with this case at some point in their career. Every GP I go into, he is just amazing. Like so generous with his knowledge and skill. Yeah.
He responds to emails at times that he should not be responding to emails, but he's very helpful.
Very helpful. Yes.
Yeah.
In the middle of the night.
When I'm 11 o'clock, I'm finding out about stuff and he's like replying. Yeah. And he's super helpful.
Yeah.
Especially for fungal stuff. And yeah.
Yeah. And everyone just goes, yeah, email Richard Malik and gives out his email address. And
I'm not giving out his email address.
Never complains. Honestly, he's amazing. Many animals have benefited from Richard Melick's knowledge. Okay. Surely that's enough fungal. We don't really get histoplasmosis here, do we? Do we?
I don't think we have it in Australia, do we?
No, it's like a Mississippi localization, like the deep south, is my understanding.
Okay. Yeah, I remember having to learn about it for the NAVLE, and then I haven't looked at it since.
Wipe that. Yeah, Mississippi. Endemic in, yes, like bird and bat droppings in the Mississippi region. So we can ignore that completely. The other one, cryptococcus can cause gut granulomas. In dogs. But again, you'd need histo. Like it needs to come out. So if you see a mass, take it out. Yeah. So it doesn't, it's just not really clinically relevant at all, except that you might get an interesting surprise on your histology. Okay, let's talk about viral pathogens. Are there any in particular that you guys want to cover relevance-wise? Like what you're seeing clinically?
I see parvo, but I think most people know like the pathophys and all that sort of stuff that kind of revolves around parvo. It's so common in GP land anyway.
Again, I'm very spoiled. I don't know parvo.
Neither do I, but in my first job I saw it, so I can say that in my career I saw a lot in my first job as a new grad, and haven't seen it much since, but at least I got that experience.
I think you can diagnose it on smell alone. If you've seen it.
I can't. Okay, so we say you've got a patient with acute hemorrhagic diarrhea and you do a fecal PCR and it comes back positive for parvo. Is there any limitations to a positive test with parvovirus?
Is your PCR potentially affected by vaccination?
It is, yeah. So vaccinations, the PCR is detecting genetic material. So if a modified live vaccine is given, contains genetic material. So that can cause a false positive on your PCR if it's done within 2 weeks of the vaccination.
Okay.
And unfortunately, it's often puppies that we're seeing, and they're within 2 weeks of a vaccination, yeah, for half of their life, basically. So it is just something to have on your radar that it may or may not be parvo. It doesn't change how we'd manage them, really. What's the other support?
Yeah, I was like, would you, like, obviously my go-to for parvo is a in-house snap test or an
which is an antigen test, I suppose.
Yeah. So therefore it kind of can differentiate between the vaccine and the non-vaccinated because you're not looking for antibodies. So like I don't think I've ever had any false positives with my parvo tests. I've had false negatives for sure, but
so in theory, if you've given a modified live vaccine, there's antigen there.
It could still test.
Yeah, I don't think, because the PCR is very sensitive, it will detect the tiniest amount of genetic material. I think you're more likely to get false positive on PCR, whereas the SNAP, like the chances of there being a large volume of genetic material in the gastrointestinal tract if you're testing on poo is like very low.
Yeah.
In theory, I wouldn't say it's impossible. I don't know what the actual numbers are. A fecal ELISA, which would be the SNAP test.
Yeah.
Yeah, false negatives early in disease or with a modified live vaccine. False negatives.
False negatives, okay.
Negatives.
Yeah, like I wonder if it suppresses.
Yeah, because what I kind of remember kind of being told is early in disease when they're not shedding a lot of material, you can get the false negatives. You can also get false negatives very late in disease. And I can't remember if that's because they're just shedding so much of just intestinal lining and stuff that it's
Okay. Yeah.
But I mean, in a clinical setting, when I've had a puppy that's had acute vomiting, and I've got blood on my thermometer, I don't think I've ever had a false positive from, even though they've had one vaccination.
Yeah.
With the clinical picture, it's quite
distinctive.
distinctive.
And tell me, what other signs might you see if you've got no cost limitations and you can do all the tests in the world? How does parvovirus behave, and how might it impact our blood results and other clinical findings?
Yeah, so it attacks rapidly multiplying cells. We typically don't get the neurological or the cardiac side effects that they have previously done, but we do get the low neutrophils. That's probably the most common, like, white blood finding. The anemia is obviously related to typically the clinical sign of the blood loss, because it's eaten away at the lining of the GI system. And then a lot of the time they also do have hookworm and other strongles with them too, which add to the anemia. To be honest, I don't think I've ever done biochemistry on these dogs, because it's like the least of our worries, and trying blood from a puppy is like praying to God most of the time. So normally I get enough for a CBC and like a PCV TP blood smear sort of thing. But I do know that the low neutrophils typically can correlate to a poorer prognosis for survival rates.
Yeah.
Be all I know off the top of my head.
And I guess that's an important, because I think a lot of people with like an acute hemorrhagic diarrhea syndrome, you wouldn't always do a CBC, like if the clients were cost constrained.
Yeah.
But it definitely might change the prognosis and the way that you would manage that patient. Like, and if a client's kind of saying, "Oh, I don't want to do a PCV, CBC, I don't want to pay for it," and you sort of say, "Okay, well, your dog's got a neutrophil count of 0.2. I don't think you should invest in hospitalization and things, because the prognosis is going to be poor." Like, if we're quibbling over $80 here, we're going to be talking about $5-6 grand, and you might not have a dog at the end of it, kind of thing. Like, it can, when you get that information, it can help guide those discussions for the owners that like just need a little bit more, like, is it worth investing this? The treatment of parvo is also going to be quite different from other causes of hemorrhagic diarrhea, because we've got like quite severe neutropenia in some of these patients, isn't it?
Yeah.
There's lots of hemorrhagic diarrheal syndromes that will disrupt that mucosal barrier and put patients at risk of sepsis. And we have to be wary of that and manage evidence of sepsis as it arises. But these patients are so compromised with their low neutrophil counts because of parvovirus specifically attacking those bone marrow cells. So in these patients, definitely broad spectrum antimicrobials are indicated, as well as like all of the other stuff, analgesics, immunoprotectant, hydration, blah, blah, blah. So it is an expensive hospital stay, typically. Preaching converted, obviously, Katie. But
yeah, you know, I've had some clients that would let me do absolutely everything, and I had some clients where I'd even go for like the outpatient, like if they were over 10-kilo puppies, and they were diagnosed with parvo and the people had no money, I did the subcut fluids at home, the injection confident before they left, some ondansetron wafers, and had pretty good success with that. So I think, it's more looking at the clinical picture and deciding what their prognosis might be, what you can offer. But
yeah. Do you guys ever do fecal transplants?
I've done them in other cases. I did hear at a conference that it has decreased. If you do a fecal transfer, it can decrease parvo patients' time in hospital.
Yeah.
I just don't know the logistics of having to be in like an isolation ward and trying to do all that, if I'm honest.
Yeah, I think it might be nice in those outpatient ones actually.
Yeah.
That can't go ahead with treatment. Or hospitalization. Yeah, the ISO management is complicated for sure. It definitely shortens hospitalization time and improves, like, I think there's lower risk of sepsis or something. Like it kind of helps secure the gut lining, stabilize the gut lining.
If that was given per, they were giving per rectum.
Per rectum, yeah. Which is interesting. I'm like, how does that work? But it does.
Do you remember what day of hospital they were giving it? For some reason, day 6 is in my brain, but
Oh God, they'd already been in hospital for 6
yeah,
days.
I didn't think so. I think it was earlier than that.
yeah, I couldn't remember.
Mm.
I thought it was like after. I could be very, very wrong.
Mm. And then my other question for the outpatient management is how, or any patient that's like, I guess, come down with parvo in their home environment, how do you advise clients on environmental management?
We tell them the bleach ratio.
Yeah.
Tell them that if they are to have them at home, their home will probably be forever parvo contaminated.
Yeah.
So to never have another puppy ever again, only have vaccinated dogs in their home.
Yeah.
I'm going to be honest, most of the dogs that come in with parvo are from that low socioeconomic area. And so those homes have probably already had parvo from previous tenants and neighbours. And like one day I had a parvo dog come in. It was like a 9-month-old parvo, so I treated it as an outpatient.
Yeah.
The next day I came in with a 16-week parvo case and I looked at their files and they were neighbours.
Oh, shame. Oh dear. Yeah.
Like I was like, I couldn't tell either one of them, but in my head I was like, that's great epidemiology right there.
I know. Let's do a little map here. This is not complicated, is it?
Yeah. And so, yeah, a lot of these people are low socioeconomic, renting houses in low socioeconomic places of town. This is mostly when I worked in Gundawindi that I saw.
Okay, yeah.
So, yeah.
Interesting. Your perspective is so different from mine, like where I've been.
Sea slickers.
Yeah, totally. But it's so valuable. I'm very glad you're in this conversation. Yeah.
We got some puppies through parvo with, you know, 1 or 2 grand worth of hospitalization. Some, and then there'd be others where you'd spend, a ridiculous amount and still go to heaven.
Yeah. What about feline parvo?
Oh, when I was in my first job, we had an outbreak of feline panluke. Yeah, it was a big thing. Who were the 2 feline specialists in Sydney? They came to Mildura to like take samples. Yeah. Oh, I put to sleep dozens of cats in a weekend.
Oh gosh.
Yeah. Because
kittens?
the cat rescue people, mostly kittens, but some adult cats as well that had just come into foster care and weren't fully vaccinated yet. And
wow.
A long time ago, but I'm still mildly traumatized.
Yes. Can I make you relive your trauma and tell us how they present?
So most of them presented pyrexic and just super flat, but with no obvious gastrointestinal signs. So they usually presented before the gastrointestinal signs. So it would just be like a super flat cat.
Yeah.
Yep, with a really high temperature. Yep.
Yeah, right.
Yep.
So similar to canine parvo. So like once the environment's contaminated, the environment's contaminated.
Yeah, absolutely.
So contagious and so stable in the environment. So similar in the way that it impacts cats, like bone marrow, rapidly dividing cells. But there's one thing that when kittens get it, I think when kittens get it, oh no, sorry, when they're exposed in utero to it, it causes a specific syndrome. Do you know what that is?
Is that the cerebellar hyperplasia?
Yes, yeah. The first clinic I ever worked in had a cat who was cross-eyed and did this all the time. And I was like, I know what's happened to you now.
Yeah, and I've seen a couple of cats in my career that were just born like that, and they seem to, at least the ones I've seen that are still living, they seem to get on just fine. Yeah.
So cute. Yeah. Yeah, so not necessarily death sentence, but those cats have usually been exposed. I'm not going to talk any more about diagnosis because it's similar, right?
We just use the dog tests. We did, yeah.
Yeah. And often I've got a really profound leukopenia, same as dogs, so that can just help you differentiate from other causes.
I don't know what, like, I haven't read much recently about kind of treatment rates, but like they were hard to treat. There were some that we tried to treat, like some older ones that we attempted to treat, and they were really hard to treat.
Interesting.
Compared to dog parvo in my experience, yeah.
Yeah. In that they were like just pyrexic and refractory to antibiotics. Like,
yeah, well, they basically just died. Yeah.
Right.
Yeah. Like,
cats don't tell you they're septic until they're like fully septic.
Yeah. And I don't know, I perceived that maybe in dogs you got them earlier because they had vomiting and diarrhea a bit earlier. These cats were just, I mean, they were also maybe in situations where it wasn't like a one-on-one, I've just got one puppy that I'm watching, but I just recall even the ones we tried to save, it was just almost none of them lived, I don't think. Yeah. It was horrible.
I will say a lot of the dogs also present just really flat before the GI.
Okay. Yep.
Yeah.
Interesting. And then you get the blood on the thermometer. You did mention that.
Yeah, so a lot of the time it's they flat and stop eating, and then they've been like, no, there's no vomiting or diarrhea, and I put the thermometer in and there's blood on it. But yeah, it's kind of similar that as later in the disease.
Yeah. And pyrexic in the puppies?
I think that's a bit hit and miss.
I just remember all these cats had crazy temperatures, like, you know, because most real sick cats, I don't know, you almost expect them to be hypothermic, but I just remember these cats all being really hot, like 40 and a half degrees. Yeah.
Yeah, I don't think I've had that problem with the dogs. I think maybe the odd one might be pyrexic and the odd one might be hypothermic. But I think most of them were, pretty kind of normal. Like when we first diagnosed them, obviously they were still all factors in mind.
Were most of yours leukopenic? So
I think the ones that we tested were, but I don't think we tested that many. Yeah.
So I'm just wondering whether cats are presenting with sepsis rather than the virus.
Yeah, I wonder. Maybe.
Because the gastrointestinal, they don't have to come in for the gastrointestinal signs because it's so overt. And I wonder if, they're just kind of coming in once they're already, effects of the leukopenia.
Yeah, maybe.
I don't think we need to talk about distemper. Nobody's distemper, do we?
I mean, I saw a few cases when I was volunteering in India.
Oh yeah, really? Interesting.
But I hope we never see it.
Yeah. Where's Pooja when you need her? She'd be able to give us that context.
Yeah.
Coronavirus is probably worth a mention as far as kind of causes of enteric diseases. What's the significance in a cat with acute diarrhea of positive coronavirus PCR?
Not much significance.
Yeah, it's hard to know because some cats carry it forever and shed it forever. And some cats get gastro from it. So unless you're kind of doing serial PCRs and documenting whether this cat is a carrier or this cat is acutely infected, it's very hard to know the significance. But similar, if it's in the enteric form, there's no pyrexia and there's no evidence of like FIP, we treat it the same as any other acute gastro. It's just all supportive care.
Yeah.
Almost makes you not want to know what the PCR results are because it just makes you nervous that something's going to happen. There's something on the one of the labs quotes a study that says that 10% of cats with feline enteric coronavirus go on to develop FIP.
10%?
I know.
I thought like 99% of cats had been exposed to coronavirus.
I was like, this does not make sense. Somebody apply some logic to this statement, please.
That is a crazy high number.
It's a crazy high number. So I think it's quite alarming. Like you get a PCR result and then in the bottom of the report it says 10% of these cats are going to go on to develop FIP. Just absolutely, it just has to be nonsense, right? FIP is not that common, and enteric coronavirus is very, very, very common.
Yeah, absolutely.
Yeah. So I stomp my feet when I see that comment, but other than that, I do nothing. But I think we should probably treat enteric coronavirus in a similar way as just any other acute gastroenteritis. And more work's being done on, like, in humans, it's rotavirus, norovirus, and like there's so many different gastroviruses. And there's emerging evidence to say that animals are the same. So a lot of our acute gastros are viral. They pick them up at the dog park, pick them up out and about. Cats less so because they're less social, but it's like a human gastro. They don't test you. They don't want to know what it is unless you're fully sick and need to be admitted to hospital, and then they're only doing it to make sure that they're not missing something like that might be a risk to public health or a risk of progression and turning into something nasty. So yeah, most of the acute gastros ignore, basically. Let's talk a little bit about bacterial just to wrap up. Well, I'm going to answer this question. There are not many primary bacterial enteric pathogens. What are some of them?
I'm just thinking of like the same ones human gets, like your salmonellas.
Yeah.
Potentially factor or something.
Yeah, good. Exactly. They're the two main ones, actually. By far the most common ones that we see. Campylobacter, what's the significance of a Campylobacter positive on a PCR?
I think they found that in asymptomatic dogs too, haven't they?
Yeah. Up to 89% of dogs.
89%.
Yeah, it depends on the population and 70% of cats.
That's helpful.
It's so helpful, isn't it? That PCR. But it is tricky because it can actually be pathogenic. So it's got a few virulence factors in that it can invade the mucosa, and it can excrete toxins which cause damage to the mucosa, which can cause a secretory diarrhea. It's not, it depends on the study, but some studies have showed it's slightly more like Campylobacter, that patients that test positive for Campylobacter are more likely to have diarrhea. So there is probably some causation, but we know that not every dog and cat with Campylobacter get diarrhea. So significance, again, if you've done serial PCRs and you've never seen Campylobacter before in a patient, and then all of a sudden they present with a different type of diarrhea, and then it may be significant. But if you've never done it before, it's tricky. What I did think was interesting is that it can be associated with cholangiohepatitis and cholecystitis.
Oh.
Yeah. But
in dogs?
Dogs and cats, actually. And cats specifically, there's evidence to show that Campylobacter infection is more like cats with IBD, more likely to test positive for Campylobacter.
Makes sense, I suppose.
Yeah. I mean, and they don't know, again, causation, like the IBD, the Campylobacter may not be causing the IBD. It's probably that we've got dysbiosis associated with IBD. Yeah. So just interesting, I guess, perspectives. Again, zoonotic risk.
Well, if 89% of them are carrying it, probably not a huge risk unless they have horrific diarrhea.
Yeah. And it's, I guess if they're carrying it, they're probably not shedding a huge amount. Whereas when they've got diarrhea, they're shedding
Acute infection, yeah.
a huge amount, and they're shedding it in an inappropriate way, like it's in the house and on the pillow or whatever. So higher risk of higher zoonotic risk if the patient has diarrhea, regardless of whether it's the cause of the diarrhea, I would note. So if you can't stop the diarrhea, it might be worth treating it. Yeah, I can't stop the diarrhea with supportive care. Tell me how would you treat it?
Well, like, would you just try supportive management first with like probiotics and stuff like that? Because obviously the only way to probably treat it is antibiotics, which we don't really want to do unless it's severe.
Yeah, good. And then what antibiotic?
Metronidazole.
It's not actually, so it's a gram negative.
Do you need to use azithromycin or something?
Yeah, it's a weird one. So erythromycin.
Or erythromycin.
One, it does sometimes respond to azithromycin, tylosin, and enrofloxacin as well.
Hardcore.
Yeah, but yeah, it's erythromycin is the typical treatment of it, is what they use in humans, to my knowledge. Not that that's my field, but and I don't know whether that's then an argument for us to keep erythromycin up our sleeve and treat it with something else so that it's sensitive to erythromycin if the human gets it. But that's maybe a bigger question than I can answer. The recommendations in the textbooks just say erythromycin. Yeah. And then next big one is salmonella, right? A lot of dogs again carry salmonella. A lot of dogs test positive for salmonella without it being a significant cause. And the recommendation is actually don't treat it unless they're septic. Yeah. So just glossed over that one because I do want to talk about E. coli, because there's some emerging E. coli strains which are just a little bit more interesting. If I can find my notes. So we know E. coli can be a primary gastrointestinal pathogen, but we also know that it's in every single gastrointestinal tract. Like it's an essential commensal of the microbiome. So it becomes very hard to determine whether an E. coli organism is specific. But now that we can do the genetic testing and get the substrains and detect the genes for specific toxins or specific behaviors, we can now identify those organisms a bit better. So there's one subtype. We've got entero-invasive, entero-adhesive E. coli's. There's other ones as well. But there's an E. coli that produces a toxin called the Shiga toxin that is of emerging concern for small animals.
Well, that's what causes hemolytic uremic anemia in people.
It's so interesting.
Anyway,
I find that disease fascinating.
yes.
As a coagulation person, maybe that's what I'll talk about at the masterclass.
Yeah, you have to give me a topic because it's being finalized this weekend.
Can I do coagulation testing?
Mm-hmm.
Coagulation and testing?
Mm-hmm. Love it.
Yeah? Okay, good. Half an hour?
Plus half an hour, no, a full hour. Half an hour plus half an hour today, or whatever you want to do.
Okay. And I'm very happy to answer, like, just tell them I examined last year. Very happy to answer questions about that process.
Mm-hmm.
Whatever they want.
Mm-hmm.
Okay, so last point. So this Shiga toxin-inducing E. coli is emerging. It's previously thought that dogs were just asymptomatic carriers, but recently it's been documented in 24% of dogs with hemorrhagic diarrhea, which is much higher than the carrier rate.
Okay.
So it looks like it might have some more significance in causing disease. Cats much lower, so it seems like it's more dogs.
Hemorrhagic diarrhea, like as in the syndrome, or just like as in what we don't call HDA anymore, our ARDS, or just any hemorrhagic diarrhea?
I would have to open the paper.
That's fine. I will open the paper. That's fine.
Sorry.
No.
Oh no, I'm
just interested.
Yeah, no. It's very interesting, but like literally, I've just written increasingly recognized as a cause of severe hemorrhagic enteritis prevalence rates. 24%. So yeah, because now that they're detecting the genetic Shiga toxin developing gene.
I wonder if that is that on our PCR panels? Yeah.
No.
Yeah. No.
Oh, and I'm not sure how local this information is as well. Like I'm sure it's not Australian.
No, yeah.
We we lag behind what's going on in other countries. So worth having on our radar. 6-year retrospective study in Italy made a firm association with in their role as gastrointestinal pathogens. So causation, especially causation. So I just wanted to put that on our radar, and then we probably should wrap up. Do you want me to email you that topic, or are you happy?
Me?
Yeah.
No, that's okay. Yeah, all good.
Do it. Okay.
All
Awesome.
good.
All right. Thanks so much, Katie. Thank you for joining in. I hope I didn't drill you harder than you were prepared for.
No, it was really good. Thanks. It makes me feel better that there's some stuff in my brain. So I'll just have to
nailed that. You know way more than me about parvo and worms.
live through parvo, I think. I think you've got to experience it.
We gotta live it. Yeah. No, that's not actually. All right, guys. Have a lovely weekend.
Awesome.
Bye.
Much.